The human body is a complex, highly organized structure made up of unique cells that work together to sustain life.
How hormones influence us. Did you know that your brain is constantly communicating with the rest of your body, sending special chemicals called hormones from one nerve to another? Of course you did. Don't underestimate the power of hormones. These microscopic guys influence how your brain works and can increase or decrease your energy level, sex drive, and fat storage. They can even control your emotions and mood. In short, they're tiny, but they pack a mighty punch.
Meet your ovaries, two organs that are the superheroines of the female reproductive system. The ovaries are about 4 centimeters long and lie on either side of the uterus. They look a little like...
Hello Ritu, how are you?
Hello, I'm good. How are you?
Yeah, I'm good.
So we already talked about the ovary in introduction and the hormones affecting it. So let's talk about it more. So do you know there are 11 systems in our body, and the most important system is the reproductive system of the female?
Oh yes, I learned in my endocrinology class and I know just basic structure and everything stuff. Like I know it helps during the pregnancy and menstrual cycle.
Okay, so I know, yeah, I also learned when I was small about this basic structure and stuff, but do you know the anatomy of the ovary?
Actually, I just know the brief anatomy of the ovary. I don't know about that much detail. Just can you please explain me?
Sure, I can. But first, let us focus on the reproductive system, like how it is done, and then we'll go through the ovary. So here we have the uterus in the and the down part is known as vagina. At the side, this is known as cervix, and this is on the upper side, this is known as fallopian tubes. It is kind of hands of ovary, but it doesn't touches the ovary. And the main important part for the reproductive system, from where the pregnancy or birth of a child takes place, is the ovary. Now let's talk about the anatomy of ovary. So in the anatomy, so here as we go, the upper part or the upper ligament is known as mesoovarian ligament. We'll talk about the outermost part. The outermost part is known as cortex, and the inner part is known as medulla. Let's start from the upper part. This thin line, pink blue dotted line, which is known as germinal epithelium, which envelopes the ovary, and inside it there are connective tissues. These connective tissues are very much protected, and they are known as tunica albuginea. Now this let's go to inside it. What are these other structures talk about? We will talk about the primordial follicles. The primordial follicles are actually paused during the meiosis due to this by birth, that is at the 7th month, and the number is up to 3,000, but at puberty it goes down to like 200 or 300, and they are paused, and they cannot be like the smallest follicle or the primary follicle again. They are paused at the G0 phase. Now as we talk about these structures, here this is the primary follicle and this is the secondary, and it grows up to this bigger, the granulosa cells, also known as tertiary follicle. These primary follicles and the secondary follicle has a oocyte which is not yet divided, but when it grows and it becomes the tertiary follicle, also known as granulosa cell, it has a thin lining known as corona radiata. It secretes a lot of hormones known as estrogen and progesterone, which is needed for the which are known as sex hormones, as steroid hormones are released by this. follicle, and there is a small oocyte here which will grow into the infant. But this this structure will degenerate and it will grow into the corpus luteum. As it grows into the corpus luteum, it degenerates into the endocrine gland and secretes couple of hormones that is known as we talk about progesterone and estrogen. Progesterone basically tells us our body if we have to fertilize the egg or not to fertilize the egg. It all depends on the corpus luteum. If the corpus luteum, if the progesterone gives the signal not to fertilize the egg, then the corpus luteum will get persist and it will continue. I mean, like, it will, if it will tell to fertilize, then it will persist and it will continue for 40 weeks to pump the progesterone. If fertilization does not occur, then this corpus luteum will degenerate into this structure. What is this structure known as? This is known as corpus albicans. This corpus albicans, every time if the egg is not fertilized, then this corpus luteum will change into the corpus albicans, and so it will degenerate into the structure and it will remain like that. So this was the basic anatomy of ovary.
Oh wow, you explained it very well. It's interesting.
I
But
know,
I have,
thank you.
yes, but I have a question. Like, what envelops the ovary?
Basically, I mentioned earlier that the germinal epithelium, which is also known as vesicle peritoneum, envelops the ovary. Underneath that, there are connective tissues.
Oh, okay. Thank you. You explained really very nicely.
Thank you so much.
Yes. Do you know the function of the ovaries?
I know the basic functions as you earlier mentioned that it is helpful for, as I explained, the anatomy. So I know that it helps in the menstrual cycle and pregnancy at birth, and that's all I know about the functions.
Exactly. But I will tell you the more functions in the detail. Okay.
Thank you.
So basically, when ovary is born and with thousands of eggs, so during this ovary is to provide a proper protections when the ovum is become a mature. So this is the first function that it's protect the ovum during the when it's become the mature. And the second function of the ovary is that, as we all know, that ovaries produce estrogen and progesterone, which are two hormone, and it's a very important and play a vital role in the female reproductive system. So basically, now I'm first talking about the estrogen. So estrogen plays a vital role during the female characteristics like the mammary gland, hips, and uterus based on the estrogen. This is all about this formation is all about depend on the estrogen. But while I'm talking about the progesterone, then it is also very important, and it helps to develop mature embryo in the womb during the pregnancy. So progesterones play a vital role during mainly in the pregnancy. And the third function and last function is that in the ovary, all eggs are initially enclosed in a single layer of cells and known as a follicle, which supports the egg. And over the time when it's produced, then these eggs begin to mature. So the one is released from the ovary, and each in each menstrual cycle. So during the menstrual cycle, it's also help.
Oh, okay. Wow, that's so amazing. It's so surprising that the ovary does a lot of work in our body, right?
Yes, it's a
You
lot of fun.
explain it so well. I'm like amused. So, but I have a question though.
Yeah, you can ask.
Which hormone is responsible for the ovulation?
Oh, for the ovulation, luteinizing hormone, generally it's known as a LH. It's the hormone that other reproductive pituitary hormone and aids in the egg during maturation and provides a hormonal trigger to cause the ovulation, and it's released from the egg, and it's like in the last portion from the ovary.
Okay, that's interesting.
Yeah.
So, as we are so into in this, let's talk about how, let's find about the disease related to ovary. Do you know any disease related to the ovary?
Oh yes, there right now there are so many diseases are occurred by the ovary. As we all know, the ovarian cysts, ovarian epithelial cancer, ovarian germ cells tumor, ovarian low malignant potential tumors, and right now during like in all around the world, most of the women are suffered from the polycystic ovary syndrome.
Oh, I heard about this polycystic syndrome. Let me find out something about that. Oh, I found out that PCOS is a hormonal condition that women can get during their childbearing years, and it can affect the ability to have a child. It also stops periods, or they're hard to predict, cause acne and unwanted body and facial hairs, and raise the risk of health problems like diabetes and blood pressure. That's interesting that this disease is causing so much to our body.
Yes. So, do you know which hormones play a vital role or which hormones are responsible for PCOS?
Yeah, let me find out. Oh, I found out that androgens, progesterone, and insulin are responsible for PCOS. Basically, androgens are found in males, but it develops in female when they suffer from PCOS. Insulin insulin manages the blood sugar level, but the body does not. If the female is suffering from PCOS, then the body does not react how it should react to the sugar levels and the progesterone. What does progesterone do? Oh, it might be less amount of progesterone in the body, and due to that we have a, short time, long time of periods, and stop the periods and stuff like that. That's interesting too.
Okay. So, can you please explain me a little bit about the symptoms of the PCOS?
Sure, I can. For the symptoms, I found out that there are, as earlier mentioned, there are prolonged irregular periods, and there are facial hair or loss of hair. Also, I found out that there is a darkened skin and mood changes, pelvic pain, weight gain.
Okay,
Do you
so
know
this is
anything
very,
else? You want me to find out anything else?
yes, I have just one quick question. This is very chronic disease, even, right?
I know this is a very common disease, but let me tell you also the causes of the PCOS. The cause is like if the mother or the sister have PCOS, then we can have it. That is hereditary, and the problems related to the body is like if there is too much insulin, which can affect the ovaries and the ability to ovulate. So basically, the normal ovary is this kind, the normal in the shape, and when a female suffers from the polycystic ovary, so the ovary gets what do you say, bloated up. It gets big and it cannot ovulate the egg due to the insulin levels or progesterone levels or androgen levels.
Yeah, so do you know this is very chronic disease, and still you want to know some diagnosis and treatment about this?
No, I'm not sure about the diagnosis and treatment. Can you find me some?
Oh, yeah, sure. I will explain the diagnosis one and treatment. So, for the diagnosis, there is no test until this day to predict that this is the PCOS perfectly or not. So, the doctor will start asking by the symptoms and medical history by doing a physical exam and pelvic exam. Then there is a other possible solution that they might give you a blood test. So from this blood test, doctor will check your sugar level and cholesterol and hormone levels. So during this all basis, they can measure that you have the PCOS or not. And when I'm talking about the treatment, then treatment is totally depend on the symptoms, your age, whether you want to become a pregnant or not. It's totally depend on that basis. So for the overweight, the woman who has very overweight then is losing a little bit weight, doctor generally suggests that. And for like for the it also may help very there are some medications are available in the market. So there is a drug which is called as a metamorphine and glucophage. So this is the two medication which is important to regulate the ovulation and help with weight loss even. So this is the treatment of the ovary and
Okay,
PCOS then.
that's interesting.
Yes.
So I have one more question though.
Okay, sure, ask.
Can PCOS affect the chances of getting pregnant?
It might, because it is a hormonal imbalance, so it can hamper a normal ovulation and causes a female infertility as well as subfertility.
Okay. And can IVF and ISCI help a woman with PCOS getting pregnant?
Yes, these fertility treatments have helped many women with a PCOS to get a pregnant and have a babies. But not all the women with PCOS will need IVF. Most of the women with PCOS will consequences with fertility pills that cost around $30 or something without need for any expensive IVF treatments.
Oh,
So do
okay.
you want to know more about the IVF treatment?
Sure, if you let me know.
The causes of infertility are numerous, and so are its treatment modalities. In vitro fertilization, commonly referred to as IVF, involves the technique of artificial fertilization of egg and sperm in the laboratory. Women having IVF are given special hormone injections to encourage the growth of several eggs in the ovary. During the treatment process, the patient undergoes serial blood tests, and the doctor performs transvaginal ultrasound scans to see whether she is actually responding to the hormone treatment. Once the eggs are mature enough, ovulation is triggered with a final hormone injection, and the eggs are collected from the ovaries 36 hours later with the help of transvaginal ultrasound. This procedure requires a short anesthetic. The eggs collected from the ovary are then mixed with sample of the male partner's sperm in an IVF fertilization dish, also known as Petri dish. The eggs and sperm are left in an incubator for over 17 hours to aid fertilization. During this time, only one of the many sperm cells will penetrate the outer layer of the egg and will achieve fertilization. Following fertilization, these cells divide and multiply to form an embryo. About 60% of the collected eggs fertilize and form embryos. Generally, about 2 or 3 embryos are transferred back into the uterus 2 to 5 days after the eggs have been collected. The transfer is performed under ultrasound guidance with the help of a fine tube or catheter, following which implantation of the embryo takes place in the next 2 weeks. The success of IVF and ICSI declines or reduces with increasing female age. In women less than 35 years, one could expect almost a 40% take-home baby rate. IVF is a licensed treatment, and this method of assisted reproduction offers couples a good chance of bringing a healthy baby into the world.
So this is quite interesting that if some women are right now present with infertility and some PCOS problems, so this is the good treatment.
Yes, I also found it very interesting and very helpful. Like if you can carry a baby and you can do it in vitro fertilization, so you can have a baby, and that's really good.
Yes.
Nice talking about the ovary.
Yes, overall the discussion's going good.
Yes,
Okay, thank you
thank you.
everyone for watching the video.
Thank you so much, guys.